Welcome to SysEP Stories. The stories and scenarios in this series highlight individuals using the competencies from the Implementation Practitioner Practice Profile. In this video, Co-Creation for Implementation Planning, we will focus on the following Implementation Practitioner competencies: developing teams, growing and sustaining relationships, understanding context, and co-learning. Let's begin. Co-Creation for Implementation Planning, Part 1. Meet Julie. Julie is a public health analyst working for Implemania County Public Health in the Prevention and Community Partnerships Division. The Implemania County Council recently passed a budget mandate to fund behavioral health services in schools. The ultimate goal is to use school-based services to prevent and treat mental health and substance use problems in the county's young people. However, the mandate included few details on how exactly the resources are to be used. Luckily, Julie was tasked to lead the strategic planning process. The county has 7 school districts, serving nearly 20,000 students, so resources will have to be used strategically. Julie needs to create an action plan that is effective with broad buy-in from members of this diverse community. To do so, she will need to use her best skills related to community engagement and co-creation. Skills such as building teams, growing and sustaining relationships, understanding context, and co-learning will help her develop an effective plan. Julie knows that partnership and teamwork are critical to achieving community health outcomes. So Julie seeks to convene a community team that represents the diversity of her county. The community team needs to include individuals who can bring unique perspectives, creative ideas, and also provide relevant context and history of other efforts in Implemania. As a first step, Julie considered the many partners to be included in the planning process. Some of the most obvious were the 7 school districts in the county, youth-serving agencies, including public health, behavioral health, juvenile justice, and child welfare, and several community organizations and nonprofits, including family advocacy organizations. To build good rapport and understanding from the start, Julie talked with representatives of these groups to get a sense of their priorities and ideas. Through these discussions, Julie also identified other partners to include in the community team, such as the 3 main community behavioral health organizations serving families, several young people who are leading mental health initiatives in their schools, and influential leaders in school district's Parent-Student-Teacher Association. Having identified members of the community team, Julie used specific skills and strategies at the first community team meeting to promote engagement and co-creation. For example, to help engage and develop the team, Julie took time to let each member share their vision for a future where youth behavioral health was better supported in their county. To continue to help understand context, Julie proposed conducting a county-wide needs assessment to get broader perspectives on priorities. Based on input from the team, a web-based survey was sent to school leaders and staff, parents and caregivers, and students across the county. After sending the survey, nearly 1,000 responses were received. Among many other priorities, the data revealed that an overwhelming 86% of teachers and school leaders, parents, and students voiced that behavioral health services need to be integrated into the school system. Respondents were also nearly unanimous that there was no single behavioral health issue that needed the most attention. These top 4 issues were all rated as critical concerns to be addressed by the initiative. In fact, 85% of respondents voiced that all of these issues needed to be addressed. Julie knew the survey information provided a foundation for developing an implementation plan. But before moving forward with co-learning, Julie wanted to find a process that would ensure all voices of the large 24-member team were heard and captured. In Part 2 of this video, Julie will take her team through a useful strategy for co-learning, the nominal group process. Thank you for viewing this video. For more information on practitioner competencies, please head to the Active Implementation Hub and click the Implementation Support Practitioner Competencies tab. For more information on implementation science, check out the Active Implementation Hub.